I do.
Welcome, bar flies, to a special edition, RT Sidebar with the Mindy Conklin from the Ohio State. So we are super excited to have her coming on. We know we have some Ohio people on. Chris Schwanberger's here, but we also have the wonderful Miss Maria from our friends in Baltimore. So JB, it's an exciting day. I know you're excited.
I'm very excited. I've been looking forward to this podcast for quite some time.
So at first, apologies to Mindy. We recorded you at ARC, but it turns out we don't know how to run a podcast here at RT Sidebar. So we have to re-record, and today's today. We're super excited. I would love my friend Caroline to come on and introduce our very special guest, Mindy Conklin. And Caroline, you are on mute right now, just FYI.
I know.
There you go.
There you go. All right. It's my pleasure. You caught me totally off guard, but
I know. I love doing that. That's my favorite.
Like, why you're saying that? I'm like, right. To make sure. Like,
I love it.
So she's an amazing woman, wife, mother, friend, and Archie stepped out of her comfort zone, not only to join the first APRT master program in Ohio State University, but also to drop everything back in Ohio and be the first one to actually practice as an APRT in the VA in Baltimore. She has been changing her patients' lives. We talked about that today earlier on, how the patients love her and how she actually listened to what they have to say. She's also changing the path of our profession, bringing new light to respiratory therapy. We are very proud of you and thankful for that. It's my honor to introduce you the myth and the legend.
Yeah.
Thanks, Caroline.
Well
pretty
done,
good.
Caroline. The myth and the
I
legend.
know, being caught off guard.
That was pretty impressive.
So, Caroline, well done. Mindy, welcome to RT Sidebar. We're so excited to have you. You're our very first APRT. And I know that you're going throughout the country telling everybody about what it is, but tell us a little bit about you. Just get us started. Like, how on planet Earth, what is an APRT? How did you become an APRT? We're going to dive in deep. So first off, what is an APRT?
APRT, Advanced Practice Respiratory Therapist, if I could talk today, or advanced practice providers, just like an NPPA, but we specialize in cardiopulmonary. We work with a collaborating or supervising physician, and that will vary state to state when other programs get started and legislation gets going, whether it's a collaborating or supervising physician. So basically, can you guys still see me? Sorry, my phone just went crazy. So
you're good.
Okay. So we just specialize in cardiopulmonary and, follow up with that collaborating physician if we have questions.
Okay. So you and I've got to know each other. We met before. An APRT is what? A fancy RT or like?
So it's an advanced practice provider, which practices at above a scope of an RRT. So we do everything as an RRT and then some. So you have to have that academic and clinical education in order to practice as an APRT. Mm-hmm. It's required of 1,000 clinical hours. I think by the time I was done, I clocked in 1,200 clinical hours during the height of COVID. So between working full time and school, I was in a hospital setting about 7 days a week.
Oh, wow.
Yeah.
Wow. So can you prescribe?
I can prescribe, yes. So
whoa.
I know. So when I started at the VA, it was just a job title. I knew that it was going to be my responsibility to build it. And my first thing that I said to Daniel Witt was, we need to start from the beginning, not see any patients. We got to make everything in line before we start seeing anybody, so we don't have to take 20 steps backwards. So okay. I started writing the scope of practice for the APRT within the VA. Okay. It took about 2 months to write the scope of practice, and the scope of practice covers the outpatient setting, whether you work in sleep medicine, pulmonary, interventional palm, cardiology, or in the inpatient, you know, whether you're going to be doing intubations, working in the ICU for acute care, and all the advanced procedures. So chest tubes, your intubations, your thoracentesis, your bronchoscopies, all those advanced skills that you learn in APRT school, I incorporated into the scope of practice. Like I said, it took 2 months to write, and it took about 3 months to get approved from the powers above at the VA.
Yeah.
But they did approve it with full prescriptive rights.
Wow. And you're one of two?
Yes.
now?
So we grew by 50%. That's exciting.
Look at you. Well
I
done.
know, it's
RT
exciting.
Sidebar
So,
golf clap. Very well.
yeah.
Very
So
well
I
done.
I started a year ago, last week, and Daniel
Congratulations.
Thacker started in January of this year. So he is currently here at the VA. He'll be doing mostly all sleep medicine.
Oh, wow. Very cool.
Yeah.
Very, very cool. So I'd like to start from the beginning. So right now you are a prescriber, like a PA or an MP. You're at the VA. We're going to get to Daniel and why you're at the VA, because I think that that's an important story to tell. But let's start with you personally. How and when did you become an RT?
Oh, wow. So I didn't go to college until my kids went to elementary school. I was a stay-at-home mom. When my last one went to school, I decided that I needed to do something for myself. So I decided to go into nursing. I applied, went to my orientation that night, and my advisor was like, "Hey, Mindy, so you want to be you want to be a nurse?" And I said, "No, I have no desire to be a nurse." And I don't know why I said that in that moment of time. But it changed my path. And she said, "What about respiratory therapy?" So she told me all about the profession, and then introduced herself as a director of respiratory there at the college. So that kind of led me into respiratory therapy. I had no idea what I was getting into, but it ends up being something that I was meant to do, was be a respiratory therapist.
Holy cow. And you practice in Ohio, right?
I did. I had practice in Ohio. I still have an active license in Ohio.
Nice. JB?
Yeah, how long did it take, or how long were you in RT before you even thought about APRT, and who pitched APRT to begin with?
Oh, so I was an RT for about 9 years before I became an APRT, but 14 years total as an RT. Anyway, I was in my undergrad with the professor who introduced me into respiratory therapy, and we went to an Ohio State conference. And they used to have these really large conferences for the university. And I was introduced to Sarah, George, there from Ohio State. And we were having a conversation, and she's like, "One day you'll be in my APRT class." I had no idea, honestly, what that meant. Until I learned more about it. But, hearing things from somebody who's so powerful, not only through Ohio State, but through respiratory therapy profession, that kind of stuck with me. And I was like, okay, I'm going to be in that first APRT class. So I worked all the years as an RT. That was my goal, was to get into that program. So I worked very, very hard. I covered all areas of the hospital. I wanted to practice at the top of my scope there in Ohio. I built a good rapport with every team that I worked with, so I can learn and be a well-rounded respiratory therapist.
There you go. Mindy, so she talked about being an APRT, but for our audience that are starting to learn about APRT, when you started APRT school, there wasn't a job description. There's not a test. There's no licensure. Tell us about that, how you felt in that moment when you decide, yes, I'm going to take a leap of faith to do this. Talk to us about that a little bit.
So it was kind of a no-brainer for me.
Oh, okay.
I did kind of hesitate for a little bit because I had kids that were going into college, and they were senior and they were active in sports and things like that. And I'm like, is this really a good time? But is there really a good time for anything? Because I knew this is something that I wanted to do for years. And, I built myself as an RT for this particular APRT role. I just kind of jumped right in. And went with it. I knew that it was going to be something big for the profession. I wasn't thinking, I've never thought about this as for myself. It was the bigger picture. How is it going to benefit respiratory therapy as a whole and keep, our RTs in the profession? So
Mhm.
I just jumped in with no hesitation.
There
So
was
I knew
no hesitation, like,
no.
because my wife's an RT, JB
Mhm.
and I, Caroline, all of our friends that
Yeah.
are barflies here, like, that's a leap of faith.
Yeah. So, I mean,
That
even with a master's in respiratory therapy, there's plenty of things you can do with a master's degree. So, even if it would have taken 5 to 10 years for a position to get started or a licensure to pass, there is plenty of things throughout the profession that you can do with a master's in respiratory therapy. Advancement upwards, go into other parts of, um, a hospital setting that you can do with a master's. So, it's not like it was something that I wouldn't benefit from in the long run.
interesting.
I
So
mean, I think it's so cool though. I mean, like you set out to sea on a boat that you were in the process of building, right? I mean, you just
Mhm.
were doing it and figuring it out as you went, and
Yeah.
that is a leap. And I appreciate that you did it for us. It
Yeah.
wasn't just some self righteous thing that you wanted to do. This was
mhm,
for us to advance us as a profession, and I applaud you for that
Yeah.
because this is something we've needed for quite some time. It was always what's next. You get new grad RTs out of school now, and they're like, "Well, what's next? Did I screw up? Should I have been a nurse?" And then
Mhm.
now I actually can tell them, like, "Hold on, there's a future for you if you want to keep going that didn't exist before."
Right. And it's for us and it's for our patients because we want our patients to have the best care.
ah,
And not that nurse practitioners or physician assistants don't offer the best care, but we specialize in something very unique, the cardiopulmonary system. And we learned that from the beginning. So, working it for a long period of time, you become a kind of a pro at it. So who is better to take care of these patients than an advanced practice respiratory therapist?
Exactly. I mean, the best care is the
Hmm.
multidisciplinary team that we weren't represented at a higher level, and now we are.
Hmm.
And so we always had this eagerness that we can do better than what's currently there, and then now we have that opportunity because otherwise you couldn't do these things in our current scope of practice. So if you felt like there was more for us to do, now you can. So I really like that part of this.
Hmm.
mhm. And Mindy, my thoughts are this, because we talk about the conflict. You didn't have any conflict. You jumped in with both feet. But you said something I think that is really important for the audience to know. You were not hesitant because you knew gaining knowledge was good for your patients.
Correct.
The end point was not a job as an APRT. The end point was, I'm going to be a better therapist.
Correct. And I put that to light in my practice. I could do a full head to toe assessment on a patient, and I could tell something else was going on, whether they were having a stroke, and I'd call rapid for those. I had one patient in at Ohio State that one pupil was bigger than the other, but I did took the time to do that full assessment because I had the skill set that I was
Mhm.
able to catch this stroke in progress.
Wow, that is crazy. I
Mm.
was recently, just this week, I like to name drop, so I'll name drop. I was with Dr. Brady Scott at Rush,
Mhm.
and he talked about this a little bit as well. It's about the gaining of knowledge is important. There's a lot of times we say, well, why do I go back and get a bachelor's degree? Why do I go out and get a master's degree? It's because it gives you a knowledge base that can help propel your career. It shouldn't be the end point. It should be the journey that gets you there. So that is
Mhm.
awesome.
Mhm.
So your journey. So you go to Ohio State, the Ohio
The
State.
Ohio State.
Matt Monroe would be very upset if I didn't say that.
Yeah.
You
I
and
know
your
you're a
Ohio
Penn.
State.
You're a Penn Stater. I know.
I'm a Penn Stater, but we
Is
we all
that
love to.
lowercase t in the Penn State? It's lowercase
Yeah,
t. Okay,
the Penn
sure.
State. It isn't the. We are Penn State. The is very big at Ohio State.
It's all
So
capitalized too.
all capitalized, which is crazy. Um, so tell us about the school. Tell us about what what it was like. You went into a school that's different than regular
Mhm.
respiratory school. Tell us a little bit about your experience of school for anybody that's actually thinking about maybe following in your footsteps.
Yeah, so it's a 2-year program, currently 5 semesters. Um, the good thing about Ohio State was they were able to incorporate those advanced nursing classes into the curriculum.
Mhm.
So that way, no one outside can say we don't have the same education as a nurse practitioner, because we learned the same core um, teachings as they
Mhm.
do to go be a nurse practitioner. So your advanced pharmacology, your advanced pathophysiology, and your advanced patient assessment. Hence why I was able to do an assessment and see this patient had a stroke. So the didactic work is very important. You go in, you learn all pediatrics, all adults. And then when it come to our clinical rotation, which was the second year,
Mhm.
we broke off, and the half that went in my class, half of them did pediatrics. They went to Nationwide Children's for their clinical rotation, and we stayed at Ohio State for ours. So we did adults. So we broke off. I mean, I learned so much. The hardest class to ever, I swear, was pharmacology. It was
Okay.
just advanced nursing classes. All the classes had about 120 nurses in them to 7 RTs when we took the classes. So
Wow.
one day maybe we'll be up there where we have 120 RTs going to be APRTs. That's the hope, right? But we've got to build the profession, so we got to grow it in order to build it. So, but yeah, so it was good. So five semesters, 1,200 clinical hours later, I did a rotation like in MICU, a SICU, interventional pulmonary, where we did bronchs and we helped with we did EBUS.
Oh,
Um,
wow.
yeah, so we got to do the central lines, intubations, and chest tube placement and that kind of thing through our rotations.
That
So
sounds so much fun. Like I
yeah.
remember, like when I went to respiratory school a long time ago. We won't say how long, Jonathan Butler, but we will. But I loved clinical. And I
Mhm.
always say, like, why would you go back to respiratory school? I would do it to go back to clinical. I loved it
Right.
to be able to learn and do all those
Mhm.
awesome things. That is, I can just imagine. I get so excited. So there comes a day you graduate.
Mhm.
Yes, I graduated. What happened next? Because there was a little bit of uncertainty on what the next step was, right? So
Right.
what did that look like?
So I just went on my everyday today work full time at Ohio State being a respiratory therapist.
Hmm.
I did take on being a clinical preceptor for Ohio State
Wonderful.
during COVID. Our students, and it's probably nationwide, it took a hit when it came to clinical. Everyone was burnout. RTs across the board had, our report, our spirit was low. So
Yes.
I wanted to make sure the students had a good clinical rotation. So I jumped in and became a clinical preceptor for them. I did it for about 2 years, and that kept me busy. Um,
Hmm.
and then by the time of that end of the 2 year, my last students were cheering me on when I applied for this position as the APRT. So, I mean, that's how I spent my time really. I just used my education to keep practicing at the top of the scope and providing the best care for my patients in a hospital setting.
Hmm.
So, I mean, it was just a waiting game. We just had to see how legislation was going.
Hmm.
And, lo and behold, one day Daniel Witt popped up on the radar and it was like, hello, world, here's APRT.
So I'm glad we're following up with Daniel.
Uh-huh.
So you have been the face of APRT, but
Hmm.
there is this magic leader that's behind the scenes, and his
Hmm.
name's Daniel Witt. Describe Daniel, describe what he did to help you in your
Hmm.
journey.
Oh, Daniel Witt is just a powerhouse, let me tell you.
Hmm.
He not only got the APRT integrated into the VA system, and it went really fast. Usually everything in the government is slower.
Hmm.
This, I mean, within a month, the job posting was posted. Within 3 months, I was hired. And then by the time I got here and I wrote the scope of practice, that my job there was done. It was his job to take it to the board above at the VA and
Hmm.
fight for it. And so he did a lot. He learned a lot from the experience of going in and pushing, hey, we need an APRT. This is what they can do. He sat in these long board meetings to fight for the scope of practice so I can practice to the top of the APRT scope. So he is a big powerhouse. You know, he's been very supportive throughout the respiratory profession, the APRT profession, and through the VA. So, you know, that none of this would have been possible, you know, without him.
Yeah.
This last year. So big shout out to Dan.
He's the best. He is
Dan
the
the
best.
man.
Dan the man.
Yeah.
He also, and being at the VA, he had a little secret. He didn't have to worry about some of the licensure and things of that nature because it is through the government. So he was able, like, he raised his hand and said, I will blaze this path. I will make sure that APRT has an opportunity. Because if we were just waiting for licensure and waiting for testing, we're waiting for all that stuff, you would still be at Ohio State. And, you know, doing great knowledge, bestowing all the stuff that you have, but you wouldn't be where you are today. That's where I think Daniel is just amazing.
He's amazing, and he does it with such, I'm going to say man grace, because if I say grace, he's going to be like Mindy. So just in the Dan way that he does, and he never expects any acknowledgement. He's just Dan, and he did something that would better the care for the veterans at the VA where he is the chief. So he did it for his VA. He didn't do it for himself. Just like I went into the APRT program for our profession and for our patients, he did it for his veterans here at the VA.
JB?
Matt, can I ask a quick question about that?
Of course you can.
Sorry, I had to start driving, so I had to turn off my camera. But Mindy, is that a plan from Dan's leadership to spread that to other VAs? I know we talked about that a little earlier, but does he have something in the plans here for someone above him to talk to other VAs and make that a standard? Because I feel like I'm not sure how many classes you guys had already on the APRT program, but if all the VAs, right, for all the country could use, I'm sure they can use a service like yours, you open a lot of job opportunities for maybe someone, you know, in Ohio, they can't move so far, or in, you know, places around Ohio, and you know, put the knowledge to better use.
Yeah, so yeah, we're working on getting the APRT throughout all the VAs in the United States. Dr. Yarborough is the head pulmonary critical care physician for Veteran Affairs. He's in Texas. He's 150 million% supportive of the APRT within the VA. So he is working with, you know, other physicians and VAs to get a standard for APRT across the VA system to incorporate APRT in other VAs.
That is awesome.
Yeah,
I think it paves the way for sure, because because it's a little bit you're your own microcosm at the VA, so you can do those things. So you went to school, you were an RT, you went to APRT, you got to the VA, you wrote basically your own scope of practice. You work in the outpatient setting and you work in the inpatient setting. So tell us about what you do today. Like, what does your daily day look like?
Okay, so my hours currently are Monday through Friday. I have 3 different clinics that I run during the week. Now that I'm officially credentialed and signed off by the VA as an LIP through the VA, I can get into the more advanced things, bronchoscopy, you know, on Fridays in the IP clinic, and I can start getting into the ICU now that I'm officially official. So that is on the forefront. But Monday through Friday, I have a sleep clinic that I run. So I see veterans, assess them for sleep apnea, whether it's central or obstructive. And then I have a pulmonary clinic. So I see a lot of COPD, ILD. I'm also the lung transplant coordinator. So the patients who need worked up for lung transplant, There's like 60 some plus tests that we have to run. If they just are in the VA system, they don't have outside insurance, to get them entered into what we call a tracer system to see if they qualify for transplant. So that, I've had 3 of those that I've put through so far. And then I have what I consider one of my favorite clinics, and I never thought I would say this, is a pulmonary clinic that is completely focused on tobacco treatment. So I was at ATS last week to present my abstract that I wrote for the tobacco treatment clinic. So we started it in November. Like I said, it's a pulmonary clinic. It focuses on tobacco treatment, but if they haven't been diagnosed with COPD, I can send them for PFT. I could treat them for exacerbation. But so far, I've had 57% of my veterans who've come through the clinic for treatment, and we do follow-ups. I do follow-up for about a year, have stopped smoking. 57%, yes. The other percentage, which is 43, have cut their cigarettes nicotine uses in half. So I presented these numbers at ATS, and it blown some pulmonary physicians. They were like, wow, that's pretty impressive numbers. It all stems from the first greeting, education. You have to educate them on tobacco and nicotine health, and what smoking causes to your system, whether it's cancer or COPD, heart disease, increased risk of stroke. So I built a good rapport with the veterans, and then we talk about treatment. And I treat with 2 different medicines, and those medicines is a controller and a rescue, and they help, fight that urge for the nicotine and the cigarette through the day. And it's been really successful. So it's a really rewarding clinic when I have a veteran come in and tell me at a follow-up that they are no longer smoking. So it's been one of my favorite clinics to run. So
I think the education is the most important part that we should push at all levels, even when we're bedside, and we're giving DuoNap, we should be educating there, right? Because the best treatment we can give them is teaching them how to prevent being in front of us to begin with, right? So, I mean, this is just advanced, but I think that is something we should spread across the board. But I do have one question just sitting here, because I like what Matt said, going back to my clinical days. And I remember the first time where I was like, holy crap, I'm going to be an RT. I had to do a blood gas on a patient who was comatose, but it took me like 20 minutes. I'm sweating, I'm going to actually stick a needle in someone that, for the first time ever, that could cause harm. And I'm like, oh my God, I'm just sweating. And then, they had to like talk me through it. What was that for you in the APRT? What was it that you were doing? You were like, holy crap, I'm now doing something no other RT can do.
Well, I would say this was my most nervous part, but some RTs do central lines, like on the West Coast, Texas and Arizona area. Some RTs do that. But my very first IJ central line placement, I was a nervous wreck. This guy had COVID. He wasn't intubated. He was on non-invasive. You have to use ultrasound. We were all gowned up, and you talk about trying to stick an ABG for the first time. Try to have your hand try to go in for an IJ, your hand shaking, but you have to push in and pull back at the same time. I think that was the most nervous moment. All the other procedures were, pretty easy, I think, but just a central line, because they're like, you can nick the carotid, you can cause a pneumo. So you're like trying to do it right the first time. So you don't cause any problems with this patient. And he wasn't sedated, so he was just on non-invasive. So that's why it made me nervous, because he could hear everything we're saying. In full PPE, yes.
Yes.
Yeah.
And central lines always have an audience. So there's a whole bunch of people watching you. Like you can run and get a blood gas. Nobody even knows you were there, but everybody's like watching you, just waiting for you to get it all set up.
Because you have the nurse in the room, and the nurse is watching you. And then of course, your pulmonary attending, because that was our preceptors, were the pulmonary attendings. They're standing at your shoulder, and you're like, oh my gosh. And of course, you're already sweating because it's 150 million degrees and you're in full PPE during COVID. So, but I did get it successfully. But it was just that moment of going in for the first time. Yeah. Intubations, no problems. Bronx, no problems. That's probably the nervous I've ever been doing anything, was doing that central line.
Wow.
Yeah.
That was a great question, Jonathan. I didn't even think about it. But an IJ, oh,
Oh,
an
yeah.
IJ's fine during a code when they're like when you're resuscitating, but
That or
awake
your
on non-invasive. Oh my
Yeah, I know.
God.
That's why it's like, oh my gosh, his head was just this way. And I was like, oh, but yeah.
Please don't move.
Yeah.
Please don't move. That is awesome. So I want to I want to finish up with you're such an inspiration. You're really helping blaze this trail with your colleagues at Ohio State and with Daniel. Where do you see the APRT program, the APRT as a profession going? Where do you see it going? Where do you want it to go?
Mhm. Well, I definitely see it going within the next 5 years through other VAs throughout the hospital
Mhm.
for sure. I do foresee Ohio State has legislation in the House currently. I do foresee that passing within the next couple years, hopefully next year. That's our lucky number. And then they'll have licensed APRTs in the state of Ohio. That will open up jobs for the APRTs at Ohio State and Nationwide Children's or any other facility in Ohio that wants to incorporate an APRT. But definitely within the next year, 2 years, 3 years throughout the VA system. We're working on getting other APRT programs started throughout the country. I think there are 6 or 7 colleges and universities who are interested in starting a master's in respiratory therapy program. A couple of them are looking at a doctorate program. It'll be the
Oh,
same concept as an APRT. It's just a lot of their RTs already have masters, so they'll go in to have a doctorate in APRT. So programs, and when you start programs, you have to start legislation. So those talks have to go hand in hand.
that makes sense.
So yes.
That makes sense. I know that you sit on a task force with Daniel of other states. I'm thinking of our friend Amanda Clark down at UNC
Mhm.
Charlotte. What
Mhm.
other states or programs that are out there that are, assisting with this mission?
North Carolina is a big one for sure. They have legislation. Also, I think it's in the Senate. They have a program developed. I think they're just waiting on a clinical site affiliation
Mhm.
and the approval to get COARC accredited so they can start their program. I know Russia's looking at a doctorate program, so Russia's very
Mhm.
involved. Um, I know there's one in California. Lima, is it Loma in California?
Loma Linda.
Yeah, so I
Mhm.
met one of the professors at ATS and we were talking about it. So he has a program in his pocket that he would like to eventually get started. University of Maryland is another one who wants to be in the top 5 to
Oh,
10 universities who start an APRT program. And I know that that would be, they would come here for clinical too. And I do think there's an affiliation with Ohio State in the VA now here in Maryland. That way, if their students want to come here and do clinical precepting or clinicals, with me or Daniel Thacker, they will be able to do that also and
that is
actually have,
awesome.
yeah. So all this stuff is in a work. We have accomplished so much in a year. It's amazing. So, the AARC has been amazing. They've put aside $250,000 for colleges and universities who want to start a program. So it'll be a
Wow.
grant to help fund that kind of thing. Talking legislation across the board and how we can get other states the conversation started about that too. So
That is wonderful. Wonderful,
mhm.
wonderful, wonderful. Um, JB, any last words, any thoughts before
Yes,
we go?
one thing that, and I know it's probably going to be a barrier, but just to throw it on there is I'd really like to get respiratory into the anesthesia world
Mhm.
and get into the procedures and then the OR. And we talked about this before, but remember there's some barriers to entry. What was going on there?
I think so. We can already do some of the stuff that
Mhm.
the CRNAs can do. We can intubate. We can run mechanical ventilation. I know in the state of Ohio, when legislation passes, we won't be working in the ORs just because that's where the CRNAs are. Eventually, far down the line, when we get more programs, more people working, we
Mhm.
can venture into those settings. We could go into the cath lab. There's other places that we can work as an APRT, but it'll be state to state dependent, dependent on each state and what they put in their license. And if there's any opponents to it who say, okay, you're going to be a force, you can do what we do already, do we really want you to take, I don't want to say take our jobs, but threaten our jobs because you can do this.
Yeah.
So I mean, it'll come eventually. We need to start somewhere. So if, in Ohio, if we're not in the OR right now, that's no big deal. We can be in the ICU, we can be in the outpatient world and show physicians, show the healthcare system what APRTs can bring into our patients' lives, into the healthcare system.
Wonderful.
So to all of our listeners out there that want to help support you, what is it that we can do, even at the state level, society levels? What can we do?
So everyone needs to be involved with their state society. You got to start talking programs in your state, start talking legislation, get involved with the AARC. So if you're not a member, that's how we grow as a profession, is you have to be a member to support, the AARC in order for them to go out and fight for things that we want to accomplish, whether it's compact licensure or, they're doing HOSA to get kids educated on what APRT is. And then now the APRT, they're really pushing that. So they're trying to grow a profession. So we need to, get involved with them and support them because they're, trying to take care of us as respiratory therapists.
Mindy, where can we support you personally? So you and I have become friends. You're a barfly just like everybody else here is. I see you on socials. What socials can we see what you do? Because you post a lot and you tell us your journey. Like, where can we find you?
So I'm on LinkedIn. So that's where I post a lot of the professional stuff I've been doing and trying to keep RTs and other healthcare professionals kind of in the loop of what we are doing as APRT. But I also have an IG just for APRT because I've had a lot of students who reach out and they have questions, or a lot of RTs who've been RTs for a long time who have questions. So it's Mindy _the_APRT. Yeah. But
Capitals.
it just comes naturally. But JJ, the RT, actually gave me that idea. He's like, we need to do this to have more people reach out to you. And it's kind of been a blessing that way. My personal space, other things aren't kind of like overran with questions.
Yeah, it's
in
going
my
to
other
this one
socials.
place.
Yeah, it's going to the one place. So LinkedIn and IG is probably the best way.
That is awesome. So all the barflies out there, you're listening, you're watching on YouTube, you're doing everything. Go check out Mindy on LinkedIn. She's got tons of stuff. She tells us all about her journey. So that is a call to action to all barflies. Other calls to action. Next podcast is going to be on June 6th, and it's with Ron Pazawal, who is going to talk about compact licensure, which is what you just mentioned. So I just think that that's awesome. We also have a great webinar coming up on HYPERACT, the HYPERACT trial. That's going to be on June 11th. So check out your email, check out all of your socials to get more information on that. Mindy, any final thoughts before we go to shout outs?
Oh, I just want to thank everybody throughout the profession and the AARC and the MBRC and all the RTs out there who've been extremely supportive of the journey to the APRT and, have just kind of encompassed me. And I haven't been alone, basically. So it's made the journey a lot easier, even though I stepped into it on my lonesome, kind of by myself. I haven't been alone. So that's my huge shout out is to RTs. Like, you guys are amazing. You guys are superstars that wear a cape every day. So, I appreciate all the support.
That's awesome. We are inspired by you. We are so glad that you are a friend of ours. So that's my final thought. So Mindy, thank you so much for being so open to being our friend and telling your story, but also just being an awesome human. We really appreciate you. So my shout out is to a couple people that I know that have helped Mindy. Daniel Witt, for sure. All of those with the AARC, the MBRC that are working to help support you, Mindy. I'm also thinking about all the people that are working with state licensure, the VA. Always thank you so much for taking care of our veterans. We appreciate you for that tremendously. What shout outs do you have, Mindy?
Oh, big shout out to one of the biggest supporters I've had, even right as I graduated from APRT school. JJ the RT has been in my side pocket, a go-getter. He's so inspirational. So I have to give him a shout out. Shout out, like I said, to all RTs. This is for all of us as a profession. And I have to give a special shout out if I cry, because I incorporate my kids into my talk everywhere I go, because the kids are one of my reasons why. So a big shout out to my kids for being supportive, because they're in Ohio and I'm here. And then my husband, because he dropped everything for my dream. So yeah, those are my shout outs. And I always get teary eyed because, I'm human. So people do tear up at my conferences because I do make them cry a little bit. So
JJ made us cry last week, and now you're making us cry this week. This is the RT Sidebar Cry Fest. So, oh my God, I love your shout outs. All of us can't do it without our families. So, Mindy, thank you so much for being vulnerable and telling us that. Shout out to Mindy's husband and kids for all of us. We appreciate it. JB, follow that one.
I know. Yeah, I gotta fix my eyes and
fix your
make sure I
eyes.
don't have a frog in my throat. So a couple shout outs to Nadia Jensen. I work with her right now. She's one of the first AECs at the hospital I'm currently at. And she'll be on a future show for us to talk about asthma. Also, Stanford Hall, he's one of our leads right now. And it just so happened to be that he came to me and he was asking me, like, it'd be a good topic to bring up on the show is what's the future of respiratory? And I said, I got the perfect person. So tune in. But my last shout out, which I never ever do, is to our guest, Mindy. I mean, really, you are the trailblazer that we've always wanted and needed in our profession. I got licensed back in 2003, and we were talking about it then. Matt had already been 20 years in the field by then, but it's neither here nor there. But we always ask, what is next? And so you're the Neil Armstrong of our profession, taking the first steps for us. And I just I'm trying not to get emotional too, but I'm just passionate about respiratory. Even when I was a hospital administrator, I had quite a few departments, but respiratory was always number one for me because I love our field. And it's just an honor to know you and an honor to have you on the program. And if you need anything, you got a hype man in Matt and I. We can help you. We'll go talk to anyone we need to help. So please feel free to reach out.
That is awesome. JB, thanks, my friend. I appreciate you very, very much. So we're going to finish up what we got going on here. Thank you to all of the barflies that were able to be on. We're going to play our funky music while we finish up. I hope everyone has a great Memorial Day weekend. Spend some time with your family. Thank you so much.